Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today's episode, we have Dr. Dani Bowie, the Vice President of Clinical Strategy at Trusted Health. How are you today?
Doing great. Thanks for having me, Jared.
Yeah, I'm excited for us to chat. Been a fan of Trusted Health for a number of years. I know Lenny over there. So hey Lenny, if you're listening. Uh, and really excited to chat with you here today. I think we should dive right into it. We usually keep these things short and sweet for our audience. So if you don't mind, Dani, would love to hear more about your background and then talk more about Trusted Health.
Perfect. Yeah. So again, thank you for having me. I am a nurse and I've been practicing for about 15 years. My career has taken a couple different strategic pivots. However, I have had kind of all roles in nursing. I was at the bedside, I was a charge nurse, I was a nurse manager, and then I kind of moved into this workforce management space where I managed 8 hospitals for staffing and scheduling. And then most recently, I was at Bonds Core Mercy Health, where I oversaw our workforce strategies for nursing for about 15,000 clinicians and built out a flexible workforce model for that health system. But I would say my love or passion for workforce was really ignited when I was a nurse manager and I was spending, hours building a schedule. I was having to staff my 27 bed unit and I was constantly just coming up short. And during that time, I was also entering into my doctoral journey, and that caused me to ask the question there has to be a better way to do this, to build a schedule, to manage staffing. This is really, really tough. There's a lot of smart people out there doing this. So, what else exists in the industry, and what are the best models out there? And that led me to really understand the research, look for new models of operating and new technology to really augment the work that we do as nurse leaders.
Yeah, it's I think Trusted Health is very lucky to have you. You have a great background in the space, and I don't want to throw shade at anyone in the space at all, but
Absolutely.
there's a it's not as large of a group of people like yourself, right? That you're taking your past experiences, you're trying to help create more innovative solutions. Being with Trusted. So kudos to you and all you're doing and the team over there. I know you touched base on a few things, but maybe you want to give us maybe a even more a deeper view into Trusted Health. I remember I talked to Lenny, it was a few years back, so I know things have changed quite a bit. I've followed the journey a little bit, but would love to hear it from you. Uh,
Sure.
give us that snapshot of where Trusted Health's at, what you're doing.
Absolutely. Yeah. And so as you heard my background, coming to Trusted was just a no-brainer for me. I saw their vision and their product and I was like, yes, this is the beginning of transformation for our health systems. So Trusted is really dedicated to ensuring that patients get care everywhere. And they do this through building and supporting a healthy nursing workforce. Trusted has over 400 employees, and 20% of those are nurses. And we have national relationships with about 4,500 health systems or health organizations such as Mercy and Johns Hopkins, etc. And we have over 450,000 nurses on our platform today. So that's about 10% of the workforce. And the way that we've been going about this is that we're really digitizing the workforce experience, both for the nurses as well as for the health systems. And that's coming to this evolution with our product called Works and what it's going to do in transforming this workforce space. But we started out first in the travel nursing space, digitizing that experience. So our nurses would sign up to the platform, they'd be able to house their credentials, they'd be able to put their qualifications, certifications, things that they were looking for in their next travel job. And then our algorithms would match them to the jobs that they were looking for. So it really allowed them that flexibility and autonomy to decide what's next. And we didn't have a traditional model of recruiters. And therefore, because we didn't have recruiters, we didn't have commission fees. And so more money was going to our nurses, as well as we were giving them support through nurse advocates and really helping them along the journey so that they were able to receive the benefit of being a trusted employee and getting that support for this new experience of travel. Subsequently, that also gave our health systems direct access to talent. So they were able to secure travel nurses and contract labor in a faster, more efficient way because of this digital experience. So it automatically reduced cost. It allowed them to secure the talent more timely, and then they were able to automate it. So actually, their workforce operations or headcount to manage this was not needed. And so it really was kind of a win-win between the travel nurse and the health systems for managing this one piece of a workforce strategy, which is contract labor. And typically, health systems should be operating around 2 to 5% of their operating budget is usually reserved for contract labor. So it's a piece of the strategy that Trusted went after and did a great job really transforming through that digital experience for the nurse and the health system. But we've also taken it a step further, and we are looking at that digital transformation for a health system's whole workforce. So no longer is it just for travel, it's also for their internal team as well. So this health system now has the Works platform where they can manage all of their open shifts and their workforce strategies comprehensively and allow for automation and digitization of those open shifts to, say, a float pool nurse, and then their own nurse with an incentive shift, or a PRN nurse, and then they can move to travel, etc. So it allows them to manage all of their open shifts more effectively and really execute that workforce strategy, which historically has been very challenging to manage. That I know I struggled as a nurse manager. I was like pulling all the levers at the same time. Give me a travel nurse, give me someone on incentive shifts, doesn't matter, we just need to get it filled. And then we were running, our budgets up. We still weren't getting the needs met. So that's kind of the unique way that Trusted is going about the industry and really transforming the experience.
Yeah, that's actually one of the things I was going to bring up with you was talking about latest business product news. So it's really cool to see that you're continuing to just improve that overall offering and help with kind of really most of the stuff that's hitting those major pain points that you were facing in your previous work. Which is why I think it was a great addition to have you join the Trusted Health team and for you to join Trusted Health, because you're able to take that, we'll call it scar tissue, Danny, and clean it up and make it make it what you want while at Trusted Health using that scar tissue. If you ask anyone, that's my most overused term. I use scar tissue for everything in healthcare because there is so much scar tissue in healthcare. So
Absolutely.
really, really love what you're building. Can you dive in a little bit on give us your perspective on basically the need and demand of nurses right now, and where you see that kind of transitioning in the future?
Yeah, absolutely. So, as you heard me talk about how we're transforming the experience for our nurses and for our health systems, a big driving force of what has been causing this change or this need is over the last couple of years in particular, our workforce has definitely increased the demand of flexibility for their schedule and autonomy around that. And in fact, there's many studies that show that the workforce, that those are their driving factors for retention and recruitment. Even pre-pandemic in 2019, the HCA, they sent out a survey to ask nurses, like, what is your driving factors for retention and recruitment? And it was staffing resources, flexibility of scheduling, and then a relationship with their manager. And then that's been supported with some of our own internal research at Trusted, where we were seeing our workforce also saying, hey, this needs to improve. And about 52% of our workforce was saying there needs to be a new way of scheduling because this just isn't satisfying. So there's this big push for flexibility and autonomy, and health systems are kind of struggling to meet that because it takes a lot to accomplish that flexibility. In fact, oftentimes we have 11 operating systems to meet this need, and we have 141 touch points just to bring in one nurse. And that's just a lot to manage. And so Works, as I mentioned, our newest product, is really bringing that to the forefront to allow health systems to be able to create that flexibility for the workforce. So now the nurse is able to, on their mobile phone, select the shifts that they want to work and allow that autonomy and flexibility. And then it's also a great retention factor for that health system to say, we're engaging with this flexibility, continue to choose us as an employer of choice. and work for us. And so it's really a really fantastic way that I think Works is trying to address this issue of flexibility, scheduling, and we're seeing it also with some of our turnover metrics and how it's just that's been skyrocketing for health systems over the last couple of years. And we had one partner, our Mercy Health partner, actually, they've been using Works through the pandemic, and they've been able to see some really great outcomes as well associated with that. So they were able to increase their fill rate during the pandemic by 8% for their incentive shift participation. And the workforce is just saying, like, it's so much easier to pick up the shifts. I'm able to flexibly choose where I want to work. And it just speaks to what our workforce is looking for in the days to come.
Yeah, it's you're in such a good situation, Dani, to it must be really fun for you too, right? To help shape the future of nurse staffing. Um, you're going to use that scar tissue. You're joining a great team that's already intact, and it's great for them to be able to have your perspective on the future outlook of this industry. It'll be really interesting to see. I mean, and Trusted's place in it, right? You've really
Yeah.
cemented. I remember a couple years ago you mentioned Trusted, and a couple people would hear of it. Now you mention it to literally everyone, and everyone knows who Trusted is. So it's been great to see that path to where you are today. I know you guys will keep doing some great things, and I'm so happy that you were able to join us here today, and I hope we can have you come back on again to kind of cover other parts of the industry.
Yeah, my pleasure. Jared, I think this is just the beginning. I think this is just the tipping point of really transforming how workforce is going to be managed in the days ahead. And Trusted is leading the way and allowing tools to get into the hands of our nurse managers and give them their time back and give tools to our frontline nurses to allow them to have a better experience, to build that healthy workforce so we can sustain in the days ahead and care for patients and be ready for whatever the next emergency is around the corner.
Well, Dani, again, I'm so happy you're able to join us here today. I'm excited to talk more about trusted health and the state of the industry and future episodes. And wish you all the best of luck and the trusted health team. And thank you so much for coming on today and sharing your experience and then where you kind of see the future of the industry heading.
Absolutely. Thanks for having me, Jared.